Hi, my name is Gloria Macías Calderón. My topic is Phase 3 Randomized trial of Voxelotor in sickle cell disease. Definition: sickle cell disease is caused by the replacement of a single amino acid that results in the production of sickle hemoglobin. Polymerizes when deoxygenated, resulting in sickle cell formation. Chronic hemolysis and anemia result in vascular damage and disease hypoxia. Sickle cell disease is caused by a single amino acid substitution resulting in the production of sickle hemoglobin. Polymerization with deoxygenated resulted in sickle cell formation and membrane damage. Chronic hemolysis and anemia cause vascular damage and disease hypoxia, increasing the risk of death.
The August 8th issue of the New England Journal related to valine, and that mutation results in the fact that deoxyhemoglobin S polymerizes inside the red blood cells, and this distorts the red blood cells and causes them to lose their malleability. Normally, red blood cells are very malleable and go through very small capillaries, but when this happens, they sickle, and that's why it's called sickle cell disease. They take on, instead of a round disc-like structure, they become sort of long and elongated and not very flexible, and so they stick in capillaries, and consequently, when that happens, blood cannot get to the past those places where it clogs up, and tissue dies, resulting in pain, stroke, and lung damage and kidney damage. Voxelotor reduced sickling by favoring the relaxed hemoglobin S with oxygen-bound structure. That's the relaxed form. It's oxygen-bound, and when it has oxygen-bound, it doesn't polymerize. So the phase 3 double-blind randomized placebo-controlled trial
Application in nursing. I use medication Voxelotor and folic acid 5 mg daily vaccination reduced according to age, with emphasis of the pneumococcal conjugate and polysaccharide vaccination. Hemophil hepatitis B meningococcus. Annual evaluation of liver and kidney function and abdominal ultrasound for the diagnosis of asymptomatic gallus. Adequate nutrition and hygienic condition. Education the patient and or their parents regarding their disease complication prevention, palpation of the spleen danger if there is fever or greater palate.
And the director of the sickle cell program at Nicholas Children's Hospital. At Nicholas Children's Hospital, we established a true comprehensive care center for children with sickle cell disease. Through that, we have a nurse practitioner who works with me closely, and it's the direct contact with the patients and the coordinator of the clinic. And we have multidisciplinary clinics where, with the help of just about every subspecialty in the hospital, we are able to meet all the needs of these children who, unfortunately, by having sickle cell disease, it means they have a multi-organ damage, that prevention is a major component of a comprehensive.
Pros and cons. Persons with sickle cell disease have abnormality, elevated blood viscosity, and are generally recorded to have an increasing risk of vaso-occlusive crisis with excessive increases in the hemoglobin level. The absence of an increased rate of vaso-occlusive crisis with Voxelotor, despite significant increases in the hemoglobin level, suggests that Voxelotor raises hemoglobin level without negatively affecting blood viscosity. which resulted in improved red cell deformability and reduced blood viscosity with Voxelotor in vitro.
Conversation about how we think that's going to affect the treatment of the patient and then the payer market behind it.
Absolutely. So I guess we can start with Voxelotor. So Voxelotor is, as we discussed earlier, the landmark sort of these sickle erythrocytes is that polymer forming, the polymerization of sickle hemoglobin, and Voxelotor is being called a polymerization inhibitor. And the way that it does that is by stabilizing hemoglobin in the oxygenated state. Of course, remembering that hemoglobin has to be deoxygenated for it to polymerize. The phase 3 study was recently published in the New England Journal.
Issue apply in Ecuador. Sickle cell anemia is disease that exists in the population. Afro-descendants from the town of Chota in Babura province of Spain, a prevalence 9.76%. Prevalence for this population. The female gender was the most affected with the cell anemia disease. Sickle cell disease, the distribution of the prevalence of sickle cell anemia in range of ages, based the range of 7 to 8 years with a greater number of cases positive.
Sickle signs of anemia include shortness of breath, fatigue, and delayed growth in children. Unlike normal red cells, which are pliant, sickle cells are rigid and also sticky. They may clump together and stick to the walls of blood vessels, causing obstruction in small vessels and subsequent reduced oxygen supply to various organs. This happens repeatedly and manifests as periodic episodes of pain called crises, which can last hours to days and may result in organ damage, especially in the eyes, lungs, kidneys, bones, and brain. The spleen has to handle large numbers of dead red cells and becomes enlarged and fibrous.
Conclusion. Sickle cell anemia is a common disease in children. It is mostly hereditary. The red blood cell under a change in speck or sickle, alternating the flow of blood and causing disease, pain, and organ damage. It is not explained by the mutation of the beta chain of hemoglobin and the recurrent sickle cell formation. Can cause complications, sure, as cerebrovascular. Voxelotor is an inhibitor of hemoglobin polymerization. It working with helping hemoglobin writing more oxygen and prevent red blood cells from becoming deformed.
People need to know that there is a cure, and it's not experimental. It's not like this new thing that has just happened. It's been around for a while, and we're making it better and better. They're trying to figure out ways of not just doing the gene therapy, but having the results endure for a longer period of time. So they're at the phase where they get good short-term results, but they need to be able to do that for more and more patients and then have those results last longer and longer, 2 years, 3 years, 10 years.